So once you have decided to do a Panchakarma or an Ayurvedic retreat, first of all, congratulations. This is one of the best things you have made a decision on. And now to choose which center, sometimes it can be a bit overwhelming. You could go into the internet and search for which is the best center. What I would say, always look for the reviews and also check with the center that you want to go if you can connect with the doctor upfront. Many of the good centers, they always give yourself a possibility to have an online consultation, or you can have a conversation with through email itself saying these are my conditions, so will it help to come. Sometimes we even have guests asking they are diagnosed with some terminal diseases, can they come? We say no, please, maybe Panchakarma or Ayurveda is not the right thing at that time. You must take an immediate allopathic intervention. But in many cases, many conditions like burnout, autoimmune conditions, metabolic problems, weight loss concerns, mental health issues, not to where it is very severe, where somebody is in a borderline anxiety and depression. In these conditions, Ayurveda and Panchakarma can be very helpful, and many centers do specialize in many things. So I would highly recommend everyone to write down to some of the centers. Do you offer treatments for this? This is my condition. This is my height, weight, and my current. And even if you have any blood reports, send it upfront to them. So, for example, us in Sitaram, we offer a possibility to have an online consultation. So you could really check, is this the right place for me or not? And not every center will be fit for everyone. For some people, doing it in this particular center will be the best. For somebody else, it could be another center. So fitting the right center, it also comes with first of all, I request you to make a good intention. Let the universe guide me to go to the right place where the right doctors, therapists, and the team will assist me in my healing. That's the first intention that I request you to do. Second, look for what are the good centers that offer, and then there is this accreditation in India called NABH. It stands for National Accreditation Certified Board, which stands for patient care is the most important thing, and employee satisfaction is important, and they have certain strict protocols that needs to be followed. So this will also help them to enhance and assess the quality of the center. So first is, make a good intention. Second thing, first of all, make yourself aware what is your expectation by doing this Ayurveda or Panchakarma retreat, and document all of that and send it to few centers. And these are my concerns. Do you have? And these are your timelines. Another thing, a good center, like for us in Sitaram, we are sold out at least 6 to 10 months in advance. Certain months we are sold out 1 year prior. Certain months, like from May till September, you can request us like at least 6 months in advance, you will get a possibility to come here. But from November till April, you need to book at least 10 to 12 months in advance. So good centers are actually way booked in advance. So you also have to plan it way in advance. So when people do a last minute, you will be at the mercy of a last minute cancellation or some centers which might not be as good as how you wanted it. So the best will be to start in advance, like plan it for at least 6 months to 1 year in advance. If you plan from somewhere between end of April till end of September or mid October, you have the luxury to plan it maybe even 3 months upfront in advance. But if you plan to come from October till end of April, then you have to plan way in advance. So once you make that planning in advance, you can start writing out, and you can also ask what will be my approach. Is there a way? And you can also look at the reviews. What are people saying? Good centers will have mixed reviews. Because this is not like a hotel where you have the best customer satisfaction, because healing a patient and satisfying a customer are two different approach. But at the same time, look for the facilities, look for, are the people and the team that is involved in the treatment, are they very receptive to the patient? These are the things that you need to look into. And this way you can find out. Some of the best ways to look at it is go to the website and search for, this is your condition, how long can I go? And you could type what are the good Ayurveda retreats or a good Ayurveda retreat. Some places you have very good centers in Kerala, and also outside of India there are multiple centers that do. However, coming to Kerala will be fantastic, but if travel constraints are there, look for what is the nearest possibility. And if it's your first time, I recommend go for a short duration and just to experience how it feels like. And then you can decide, does this fit for me? Does this work for me? And then you can plan for a 2 week or a 3 week Panchakarma. And my recommendation, how long should I stay for a Panchakarma? This is my understanding with all my patients so far for last more than 1.5 decades. I see the number 18 is the magic number. So when patients come for 2 weeks, and especially if you're traveling from a new, if there is a different time zones, like you have to take a 10-hour flight, if you're coming from Europe or Australia, coming all the way to India, and you might be jet lagged for just 1 or 2 days, because it will take 2 days to recover from your flight, and you need 1 or 2 days to recover after the whole treatment, just to settle in so that you can go back. So 4 days, like 2 days to recover from your flight, and 2 days to also prepare for you to go back. So we have 2 weeks completely. That's why 18 days is the ideal number that I find it. But if you have any severe ailments that has been quite chronic for some time, like multiple sclerosis or Parkinson's or severe burnout or other conditions, you were diagnosed with cancer, you had a chemotherapy, and you want to come for a rejuvenation therapy after 3 to 6 months. In these conditions, I recommend more than 3 weeks. And you could also check with the doctor, can I have an online consultation? What is my ideal duration that I should select? So the reason why I'm saying plan in advance, when you plan in advance, you have the comfort and flexibility to choose the number of days. But as you go closer, because many centers, the rooms will be limited with the number of beds, and you will have to choose only what is available. That's why I always recommend, please choose in advance. And choosing this advance is one of the best things you can do. So you can redesign the entire year according to these dates. Just make sure if there are very non-negotiable events that are happening, just make sure it doesn't come closer to that. And that is one way you can choose the place. And you can also check the show notes in in the link, so that you can understand which are the centers that we recommend. This will also help you to understand. So it's very important that you are mentally and physically prepared before you go to a Ayurveda or Panchakarma retreat. Now let's say I am planning to go in the month of February, and now it is let's say now it is beginning of January. So I usually tell people, your Panchakarma starts before you reach the center. Your Ayurvedic retreat starts way before that. Sometimes people think, okay, anyway, I'm going to an Ayurveda Panchakarma's retreat next month, so let me do whatever I want to do right now. So if you overindulge the month prior to your treatment days will be quite intensive, and it will be quite difficult also for you to go through, because you will have to deal with a lot of withdrawal symptoms from coffee or some of your behaviors. If you are sleeping very late at night, it will be very difficult to cope with the treatments. And that sudden shift will be quite alarming for the body and the nervous system to handle. So the best way is, first I would tell them, plan your trip in such a way that you are packed at least 3-4 days prior to your departure date. Especially if you're taking a long haul flight. Let's say if you're leaving on Sunday, make sure your bags are ready by Thursday and Friday, and it's tip top ready. And make sure you're going to the airport and you do the check-in like a walk in the park. So usually what happens is people end up having last minute rush, because of course it's going to be a lot of work, because they had to plan if they have a pet or a partner or somebody who is not coming. Or if they are staying alone in an apartment, they have to deal with all of that. Somebody has to take care, somebody has to come and clean. Especially if they have a pet, somebody has to take the care of the pet during these periods. So plan all this way in advance, and make sure the last 3 to 4 days you don't end up in any last minute rush, because this last minute rush creates a lot of high cortisol, and it creates a lot of time to recover from that. And especially that long flight with jet lag, and also all of that can also create a lot of problems. So what I recommend, prepare and pack your bags 3 to 4 days prior to your departure. So this gives you a peace of mind, and plan everything like a clockwork. When I'm out of this, and also tell your colleagues you are going for a Panchakarma, put a auto reply and forward the emails or even your business calls to somebody else who can handle in your absence. The best thing you can do is disconnect from your world and connect with yourself during the Ayurvedic treatment. That is the best thing that can happen. And other things, limit alcohol or give up alcohol at least 3 weeks prior to your Panchakarma. Then limit coffee. Limit coffee means if you have a habit of taking 2 or 3 coffees, make it 1 cup a day. And maybe slowly, as you're getting closer to the Panchakarma, maybe go for decaffeinated coffee. And then try to regularize your sleep. Prioritize your sleep hygiene. Then avoid junk food, eat as healthy as possible, and eat quite light. So this will help you to get into a smooth transition. Sometimes when I tell this to people, so if I'm going to live like this, why do I need Panchakarma? No, it's not like that. If I'm living like this, we don't need. When you do this prior to your Panchakarma, your recovery will be phenomenal. You are going to make the best out of your investment of your time. See, money, it will come back, but the time is not going to come back. Money, you can earn it back, but time once lost, it's very precious. So you have to prioritize it like it's the most sacred thing, ritual for your body for that particular year. Like there are people who take some pilgrimage, like, it's a very important pilgrimage. I've been waiting to go for this pilgrimage. You have to approach this retreat like it's a pilgrimage for your inner journey. That's how you should look at it. So if I have to drop it down, pack your bags way in advance, and depending on the weather, at what time you're going, check with the center where you're going. They usually give you a checklist, what all things should I pack. Second thing, plan your things at home way in advance, so that in your absence there is somebody to take care of it. Like if you have a pet, make sure somebody takes care of the pet. If you have work, or if somebody has to take care of the home, organize all of this way in advance. And for your work, make sure that emails are auto replied or forwarded to somebody else who can take care of it in your absence. Also your call forwarding facilities. And also some centers do offer the possibility that they could send an email in case of any emergency to the center, and try to be there without any working responsibilities. So this will give you the right space to connect with yourself. And usually people who do that, they go back rejuvenated and they become much more productive in their work. So don't think that for 2 weeks I'm not able to work. No, it's actually 2 weeks you're going to sharpen the blade so that you can come back and be much more productive in your work, and you'll be way ahead in your creativity and creative output. So that's how you should look at it. And try to eat healthy, minimize alcohol, gluten, dairy, coffee, and try to prioritize your sleep. Just by doing these for at least 2 to 3 weeks prior to your departure date, this will have a real fantastic recovery time. Sometimes, especially foreigners, when they are coming outside of India, they usually ask me, should I do a sightseeing in India before Panchakarma or after Panchakarma? Usually, I recommend them avoid doing sightseeing to places where there will be a tendency to do a lot of indulgence. So, if at all you're going, avoid places that are very crowded and it can be a lot of cognitive load to your nervous system. So sometimes people say, no, I want to go to New Delhi and Agra and Jaipur and then come to Panchakarma. So if at all you want to do, the best thing is always to do it prior to Panchakarma, not afterwards, because after your Panchakarma, you want to transit back into your life as calm as possible. You have to behave like your body is recovering from a flu. Not that you will be having a flu, but it's just that during those 2 to 3 weeks when you have the treatment, your body is in a bubble in that center. We are going through a lot of cleansing programs. Your mind will be going through lots of ups and downs. Many things that you have been withholding or suppressing in yourself, it might have a flare up and come out, and you would have some lot of ups and downs for good reasons. Like we always say, when you're washing a plate, at the time of washing it will look a bit dirty, but after that the plate is going to look super clean. So during those 2 weeks, your body is going to be like that place that is getting washed. So at that period of time, you don't want other chores and other things. So, and after that, your body also needs time to recover from that. So the best example, one of my professor used to tell, you have to behave like you're recovering from a flu after your Panchakarma. How do we behave after when we are recovering from a flu? We avoid crowded areas. We avoid staying up late at night. We avoid going to parties. So when you're going back, settle into your life like you're recovering from a flu for at least 3 to 5 days. And then you can get back to your normal life. After your Panchakarma, your body is going through a recovering stage, because you're putting the body through a little bit of stress. Because First of all, there will be a lot of emotional stress because you've been used to certain food, you've been used to certain habits. Suddenly, there is a shift in that. And because once you come to the retreat, within 2 3 days, you'll be sleeping at a particular time soon after the sunset. You'll be eating food early and regularly. And so this transition is quite stressful for the body because let's say a kid, he was used to get whatever he wants and suddenly he's put into a discipline, there'll be some tantrums that the kid will do. Same way the body will also do some tantrums because of the withdrawal symptoms, because the body has been so spoiled by whatever it wants, and suddenly the body has to go through a stoic disciplined way of living. So after that, and same way when you get back, through that period, the body will have some ups and downs with its energy. And you are putting the body through a purification process. And after that, you need some time to recover from that. So, certain doctors prescribe at least equal number of days of your panchakarma should be invested in your recovery. But in my experience, you don't need to invest the same number of days. So, let's say you come for 2 weeks, you don't have 2 weeks because it's already 2 weeks is a lot of time of your precious time. But if you are very focused on your health, if you prioritize health and vitality is your priority, then definitely will be a very good time for you. So usually after 2 weeks, when you go back, I highly recommend at least 4 to 5 days. Minimize any high intensity workloads from your job or anything with family. Try to space it in a way that at least for 3 to 5 days, you just start step by step. Get into work step by step. Don't engage in high intensity meetings where you have to make a lot of decisions. Slowly, gradually step into the work. That way, it will help you to come out of it. And also, there is one thing. So, when I tell people you have to be prepared 3 to 4 weeks prior to punch, sometimes, let's say, people decided, no, I managed to get a possibility to go for a panchakarma in this place, and I don't have time to do all this 3 weeks. I have to go immediately. So even if you're going immediately, it's fantastic. You will be able to benefit it. Like, you see, when you go for a yoga or workout, when you plan it in advance and go for it, it gives you a lot of benefit. Like, I go prepared, I go there way before in time and put my yoga mat and warm up and put my intention and do it. And then after that, you have enough time to get back. You're not in a rush. It makes that the return of investment of that time and doing that yoga very worthwhile. The same approach. But let's say I only have this time, but I can do it. Yes, still doing that yoga or any workout in gym will definitely help you. But it's not that it won't help you. But I'm just telling you what is the best method to make the return of investment of your time there. So that's why I'm telling people to be prepared and have that intention. But if you don't have that much time, still go and experience it. It will give you a lot of ideas, a lot of inputs. It will change your mindset, what it means to be healthy. And remember, it's not like everybody who's going to Panchakarma will have the same results. Many people will have treatments will vary because where we all are in different stages. We all have different starting points. We all have different backgrounds, and we will be in a different stages of life. A woman in her menopause and a woman post her pregnancy, delivery, and she's recovering, and they are in a different time zones of their life, and their needs, health goals will be completely different. Same way with a man in his 60s and 70s will have a different health goals and challenges than a man who is having high blood pressure and diabetes, and in their mid 40s or early 40s will have a different goal. So depending on what timeline of life you are and what challenges you are going through, it will vary from person to person. So let's say you don't have time to prepare, like I mentioned before the Panchakarma. You don't have time to even have the transition recovery period after Panchakarma. So does that mean I should not do this? No, you still have to do it. And if you are in that particular state, you must do it even more importantly. But tell the doctor when you're doing it, I really don't have time to go through a recovery stage. So maybe I may not do it as intensively that my body, because if I do it very intensively and then if I immediately jump into work and all the intense responsibilities, then I might feel tired and I might start associating Panchakama is very bad. So instead of doing that, tell the doctor, maybe I don't need to do that much intense. I just need some time off and go through some of the basic purification therapies which my body can handle it, and I can immediately get back to work. So we regulate the intensity of the treatment accordingly. So that is how you can, but still I recommend you to, because once you do that, then you will start prioritizing, oh, just by doing this low intensity therapies, I am feeling so good. So how will it feel when I do a proper one with proper intention and when I'm going in with a prepared mindset? So that will give you the incentive to think I should prioritize more. So that's why I tell people, do it even if you have only 1 week. There are centers which might be able to possible to do it for 1 week, and maybe you don't do the entire the protocol. Maybe just few treatments, maybe just external treatments, maybe just sleeping on time, eating on time. That itself will have a huge impact on you, and doing some of the treatments will have an impact on you. So going and tasting it for the first time, if it's for the first time, doing it just for the understanding what it does to my body, that will be the first step. It's like the baby steps to getting into your health and vitality journey that you need to look into. So there is a myth that if my periods are going to clash with my treatment days, then it's better not to go, and those days will be wasted. So this is one common question I keep getting when people are inquiring for their treatments. So let's look at what are the Ayurvedic textbooks, what they have documented. During your menstrual cycle days, we cannot do the intensive purification therapies, which includes like treatments like Vamana, Virechana, and Vasti. But there are many other complementing treatments that can be done during your menstrual cycle days. But the reason why I tell you should really not worry about if your menstrual cycle is going to clash with your treatment days is, usually many women today during their menstrual cycle, so if you look at the textbooks and some of the ancient guidelines, how a woman should be during her menstrual cycle, the more she rests, better her recovery after that. Because menstrual cycle itself is like a cleansing and purification therapy in the body. An unused egg is being eliminated, and along with that unused egg, a lot of unwanted waste is also being cleansed. It's just like, another cleansing protocol the body has to go through every month. And usually during this period, woman, if she is into work or in a career oriented, and if she has a lot of family responsibilities, there is a high possibility she engages in a lot of working course. So this will make her not to go through that menstrual cycle days on a good recovery patterns. So when she comes for a Ayurvedic Panchakarma retreat, that is a time when she can invest time for herself. Yes, we will not do the intensive purification therapies, but there are many other therapies that can be done according to that condition. Maybe certain treatments can be done to, if she's having menstrual cramps, how she can reduce that menstrual cramps with certain Ayurvedic treatments. That will also change her association with menstruation, that, oh, I didn't know that menstruation can be pain-free. These things can also be added to that. And usually, what I've also seen sometimes when patients come for fertility, like one of my teacher, Dr. Bhagavati Ammal, she used to say, if we can do Panchakarma prior to your menstrual cycle and during the menstrual cycle, you will see a change in the quality of the blood. Because after the Panchakarma, the purification can be a little more intensive during the menstrual cycle days. And post-menstruation, she will see a lot more vitality, and her fertility grade will also go up. Now, these are certain examples. Please do understand that it can vary from person to person. But the take note of this, what I'm trying to say is, you should really stop worrying about if the menstrual cycle is going to clash with those days. If you are staying for 2 to 3 weeks, 3 to 5 days, if that happens, consider it as the best thing that is happening, because you will be without any of your home responsibilities, work responsibilities, and this will be the ideal time to go through that menstrual cycle in a very sacred manner. Along with that, a good doctor can put the protocol in such a way that it aligns with your treatment needs, and your menstrual cycle will also happen without creating any problems. So that's why I say you should really not worry about if your menstrual cycle are going to clash with the dates.